I'm excited to be able to talk about something in this committee that's actually meaningful to American people, lowering prescription drug costs and increasing access to affordable care. I'm happy we all agree that drug prices are out of control. Yet we seem to be the only country suffering from this problem. This committee's 3-year investigation into drug companies discovered many ways that pharmaceutical companies prioritize profits over people, including flagrant anti-competitive behavior to maintain their monopoly pricing. Mr. Isasi, how specifically has anti-competitive behavior led to higher drug prices?
It's driven out competition. It's created consolidated power amongst individual drug makers, and they raise their prices without, unchecked.
Thank you. This committee also found that drug companies were specifically targeting the U.S. for high drug prices because Medicare can't negotiate the price of drugs directly with those companies. So, Mr. Isasi, can you explain how the U.S. is different from so many other countries in this way, and how that's led to higher drug prices?
Yeah, that's exactly right. We are talking about an industry that is over $1 trillion industry a year. Half of their profits are coming just from the U.S. and Canada out of that $1 trillion industry. So they are fleecing Americans. And until we passed the Inflation Reduction Act, we had no ability to get in there and negotiate a fair price. And it's really important to point out Part D, which is the benefit that allows seniors to get prescription drugs, so important, was designed so there was no real negotiation. It was designed so there were small regional prescription drug plans who couldn't really negotiate, had no negotiating power. So it was, by design, a terrible deal for the American public.
Mm-hmm. People across the country have been struggling for years to afford health care. Though important, drug prices are just one piece of that puzzle. How do drug prices inflate overall healthcare costs that families pay? And what does this mean on a practical level for someone who relies on high-cost medication?
Well, what we know is in many cases, a quarter of all the premium increases you're experiencing are because drug prices are going up so fast. And what's really important to say is, for lots of people out there aren't taking prescription drugs, right? So they don't even realize that every year their premiums are going up because prescription drug companies are fleecing them. And it goes into the risk pool of your employer, the risk pool of your insurance program, et cetera.
So in keeping with that point, more than half of overall spending goes to so-called specialty drugs, even though they make up about 2% of the medicines dispensed. This designation is defined differently across market by PBMs. Mr. Baker, can you explain how PBM's arbitrary decision-making on whether to label a drug specialty is affecting patients?
Yes, absolutely, and that's an incredible point. In the pharmacy industry, we can pretty well come to an agreement on what is considered a brand and generic drug. It all stops there. So this world of specialty has really started growing since about 2014, 2015. It is exponentially growing, to your point, being 50% or more of all spend today. And PBMs can call any drug they want a specialty. Every PBM will have a different specialty list. Every PBM could have a different specialty list for a different type of fulfillment channel. So the specialty list that we use for independent pharmacies could be different than the one I use for my own PBM pharmacy if I wanted to use it. So this lack of transparency and ability to have oversight on what is considered specialty, limited distribution, or other does drive to a lot of profiteering.
Thank you. In the end, this is actually a somewhat simple conversation. Drug companies set drug prices. If the drug companies set lower prices for medications, American families would pay lower prices. That's sad. It's important to understand the context in which those drug companies operate and who they operate with. Americans shouldn't have to choose between feeding their families and their diabetes medication. We shouldn't have to go into bankruptcy to treat our loved one's cancer. And we shouldn't have to raise thousands of dollars on a GoFundMe site when we're injured in an accident. This is a uniquely American problem. Our healthcare system is broken and rotted to its core on every level. PBMs are just a part of a greater problem, and we cannot allow them to be a scapegoat to avoid addressing true issues. Americans deserve universal health care. We deserve Medicare for all. And with that, I will yield back. Thank you.